బ్యాక్ వెళ్ళాను కదా అంతే కదా ఫుల్ స్క్రీన్ పెట్టాను సార్ ఇట్లా ఉంచాను
ఫుల్ స్క్రీన్ పెడతాం సార్ మనం మాట్లాడిన తర్వాత చెప్పండి సార్ వినిపిస్తుందా సార్
Audible, sir. Very clear, sir.
Okay, sir. Sir, I am ready.
Okay, sir, 1 minute. We'll play the promo, sir.
Yes, sir.
Everybody, a warm welcome to this important webinar. On this significant day, World Hepatitis Day, it's truly an honor to see so many distinguished guests and participants joining us. This year's theme, Hepatitis, Let's Break It Down, underscores the critical importance of collective action in combating this global health challenge and dismantling the barriers to care and prevention. I extend a special welcome to the management of ASR Homoeoapthic Medical College, our chairman, Dr. Naresh Babu Garu, and the founding chairman of ALISHA Academy, Dr. Umar Alisha Garu, and the dignitaries from the National Commission for Homeopathy and the NTR University of Health Sciences, Vijayawada. Your presence signifies the collective commitment to public health, and we are immensely grateful for your valuable time and participation. We also recognize a warm and welcome all our esteemed college principals, students, and faculty who have joined us. Your leadership and support are invaluable in reaching a wider audience. Today, on World Hepatitis Day, and in line with the theme, Hepatitis, Let's Break It Down, we are gathered to deepen our understanding of liver health and prevention and management of hepatitis. We have an incredibly insightful session ahead. We are particularly excited to hear from our esteemed speaker, Dr. K.S. Somasekhara, whose pioneering work, including Save the Liver Foundation and conducting extensive awareness campaigns, for hepatitis perfectly aligns with the spirit of this global day. I will introduce him in more detail shortly. Before we delve into the core of our discussion, I would like to invite all our viewers to engage actively throughout the webinar. Please feel free to use the chat box or live webinar chat to submit your questions and comments, which we can clarify from our speaker. It is my distinct pleasure to introduce our esteemed speaker from today's webinar. For today's webinar, Dr. K. Somasekhara Rao. He is a highly accomplished senior consultant gastroenterologist and hepatologist, currently practicing at Yashoda Hospital, High Tech City, Hyderabad. He holds immense academic credentials with an MBBS, MD in general medicine, and DM in gastroenterology. With over 15 years of extensive experience in gastroenterology, Dr. Somasekhara Rao is renowned for his expertise in endoscopic procedures, having performed more than 30,000 diagnostic and therapeutic endoscopies. He is also a skilled transplant hepatologist, having a vital part of approximately 500 liver transplantations over the last decade. Furthermore, he is recognized DNB teacher for gastroenterology students. Beyond his clinical excellence, Dr. Somasekhara Rao is dedicated advocate for public health. He is a visionary founder of the non-profit organization Save the Liver Foundation. Through this initiative, he actively conducts numerous health camps emphasizing education on general liver and gastrointestinal health. His significant contributions include conducting widespread awareness and screening campaigns for hepatitis across Andhra Pradesh and Telangana and parts of Karnataka, screening over 50,000 people and providing free treatment and vaccinations to thousands with the aim of eradicating these deadly viruses and preventing liver diseases. His remarkable dedication and contributions to the medical field have been widely recognized. He has honored as the best doctor South by Times Group in 2021 and as an icon in gastroenterology by Times of India 2022. We are truly privileged to have such an accomplished and community-focused medical professional with us today. Please join me in extending a warm welcome to Dr. K. Somasekhara Rao garu. Sir, please continue with your session, sir. Thank you.
Thank you, sir. Yeah. Very good evening, everybody. And as Sir has already told, today is World Hepatitis Day. And I thought this is very, very important for all of us to know about hepatitis and liver diseases. A lot of awareness is there about heart diseases. Everybody talks about diabetes, hypertension. Yes, and a very less awareness about liver diseases and what causes liver diseases, and especially a very, very less awareness about hepatitis viruses. So when we say let's break it down, I think we should start with improving awareness and talk about it. So today my talk will be about liver diseases and causes of liver diseases. Actually, the most important thing is why are we talking about liver? So liver is the second largest organ in our body and it performs more than 600 vital functions, but least talked about. And whenever a liver gets damaged, it happens very, very slowly. It is not that suddenly liver gets damaged. It's a very, very rare occasion where we call it as acute liver failure. And when we are talking about hepatitis, why are we talking about hepatitis? What is its importance? So hepatitis is the world's seventh leading cause of death, and it's killing more people than HIV, more people than malaria or tuberculosis. And the most important causes for death in caused for by hepatitis, most important are cirrhosis and liver cancer, and sometimes it is liver failure. So these are the three important causes of death caused by hepatitis. but we don't talk about these things. And most important thing why we should talk is, if we are able to identify these problems at an early stage, it helps in preventing the progression of liver disease, and in sometimes we will be able to reverse the liver disease also. That's why we should know it very early. If we know about it, we will be able to detect it early. So when I'm talking about liver, save the liver was my is what I was actually my heading. So from whom should we save the liver, and what are the problems liver gets from? So as all of you are aware, alcohol plays a very important role, but there is a lot of thought process going on that if someone doesn't take alcohol, their liver will be absolutely normal. No, see, alcohol causes liver disease. Maybe it is the highest number of cases of liver disease are because of chronic alcohol intake. But at least 50% of liver diseases are non-alcoholic. Please remember this. And among the most important problems to the liver, hepatitis B and hepatitis C infections. These two are viruses which are chronic viruses which can stay in your body and cause damage. This is very important that you know about these viruses, and how do we detect them, how do we treat them, how do we prevent them. All these things should be known. And the other most important cause which is rising today is fatty liver disease. If I am talking about urban population, at least 50% of urban population have fatty liver disease. So very unfortunate, because of the dietary habits, change in lifestyles, lot of fatty liver disease is being seen. Then when we are talking about other causes, some medications which are used for different diseases, they can cause liver problem. And other most important thing is something called autoimmunity. Autoimmunity is your immune system is become hyperactive and it damages your own organ. And in this case, it is autoimmune liver damage to the liver cells. This is called autoimmunity or autoimmune hepatitis. These are other causes of liver diseases. When we are listing all these things, we must have covered at least 95 to 97% of all the causes of liver diseases. There are few cases which we see genetic abnormalities which cause liver diseases, and some other causes which comes in less than 1% of cases. So pictorially, when I'm showing these are the causes of liver diseases: excessive alcohol, regular alcohol intake, drugs. We don't know, whatever any of these medications can cause damage to your liver. Be aware of them, and whenever you are being prescribed medications, you have to look for your changes in liver function test. And the most important thing today is the type of food. Excessive fats in your food is increasing fat in your liver. So when we talk about each and every disease, alcoholic liver disease, as all of you know, this is the most important and most common cause of liver disease. And there is a spectrum where most of the time, in 90% of alcohol-related liver disease, you see fatty liver. In at least 15 to 16%, you see something called hepatitis or yellowish discoloration of eyes or jaundice, which is called alcoholic hepatitis. And in majority of them, liver disease happens slowly without in giving any warning, and only when the liver completely gets damaged or it becomes cirrhosis. The end stage of liver disease is cirrhosis of liver, and once the cirrhosis occurs, that is when you start having symptoms. Symptoms can be, I will be talking about the symptoms, but they can vary based on the complication you are seeing. And most important thing is, it is not just affecting the health, it is actually draining out the family both emotionally and financially also. So we need to understand this. And once upon a time, people were actually talking, people from medical faculty were also saying small amount of alcohol is good for your heart, regular intake of small quantity is good for your heart, lot of things. But remember, no alcohol is good alcohol. Any amount of alcohol will damage your liver and progress to liver cirrhosis. So when these things were advocated somewhere in 80s, the lifespan of an individual average lifespan was just around 60 to 62. So now, after this, the cardiovascular risk factors, all of us identified very well, and cardiovascular medications, treatments have improved a lot. So all these people who had liver problems or who might have had liver problems after 60, they had mortality because of heart problems, and we never knew what was going to happen after 60, 62. But now the average lifespan has gone up to 78 years, and lot of people who have been drinking or whatever permitted amount of alcohol per day are coming to us at the age of 60 or after 60 with cirrhosis of liver. And there is no other cause except alcohol in them. So remember, no alcohol is good alcohol. And most important thing, anybody at any stage of liver disease, if they are diagnosed to have alcohol liver disease, any spectrum, strict abstinence from alcohol is the only treatment, and that too, in the early stages, helps in reversal also. So remember this thing: strict abstinence from alcohol is the only treatment that, and it is also in early stages. So, coming to our actual topic today, hepatitis B and hepatitis C. I will talk about hepatitis B first. So, what is hepatitis B? Hepatitis B is a virus which can cause both acute and chronic infections in humans. Many people have no symptoms during the initial infection, but in some cases of acute hepatitis B, the people can develop a rapid onset of sickness with vomiting, yellow color skin, feeling tired. There can be dark urine and abdominal pain. And most of the time, even if someone has symptoms, the symptoms last for few weeks, and rarely does the initial infection result in death. So most of the time, this acute hepatitis B can be self-limiting in majority of cases. But the problem is with the chronic infections. Most of those with chronic disease or chronic hepatitis B infection have no symptoms. And over a period of time, this chronic infection can lead to hepatitis, that is inflammation in the liver cells. And this eventually, if not identified at an early stage, will progress to cirrhosis and liver cancer. These are very important things what we need to understand and when to stop that. And when we are talking about hepatitis B and hepatitis C, we need to understand how they are transmitted from one person to another. So all of you know how HIV is transmitted from one person to another. It is called parental transmission. That means exposure to infectious blood or blood fluids. Both hepatitis B and hepatitis C are also transmitted in similar way, and the uh, the infectious rate or chances of spreading hepatitis B and hepatitis C are more higher than HIV. So how does this spread? Infection around the time of birth from mother to child can happen. This is called perinatal transmission. And there can be transmission from contact with other people during childhood. Most of the time, what we generally see is open wounds are very, very common in children, and transmission can happen from open wounds. And intravenous drug abuse, sexual intercourse are other routes of infection. And 20, 25 years ago, we have seen a lot of injections which were unsterilized, needles, syringes were unsterilized. At that point of time, a lot of hepatitis B and hepatitis C infections were spread in the community. And razors were reused 20 years ago. That was one more route of transmission of hepatitis B. And surgical and dental instruments were not sterilized adequately. Those were other routes where hepatitis B and hepatitis C have spread into the community. So all these things are now controlled very well, and the spread from blood banks, that is very, very important. Only blood banks which are notified or recognized by the governments should be issuing blood and blood products. So whenever we are taking blood or blood products, for many reasons we have been getting transfusions done. We should see whether it is a notified blood bank because only these notified and recognized blood banks do something called NAT testing, nucleic acid testing for HIV, HBsAg, and HCV. So if we are not taking blood from these blood banks, there is a risk of transmission or hepatitis and hepatitis B and hepatitis C. And most of the time, dialysis units, if the tubing is not changed perfectly, if the tubing is not reused, there is always a chance of transmission of hepatitis B and hepatitis C. So these are various modes of transmission of hepatitis B and hepatitis C. So if you know this, if you are aware of these things, we will be able to decrease the spread of hepatitis B and hepatitis C viruses. So hepatitis B is a preventable disease. There has been a vaccination since 1982. So at some point of time between 96 to 2000, there was some good drives, vaccination drives, which were happening, and many people got vaccinated at the time. And children who are born after 2011, because of hepatitis B vaccination has become a part of uh, immunization program. So universal immunization program, there is hepatitis B vaccination. So all children are being given after who are born after 2011. So children who are born before 2011 and all other adults, anybody at any age can be vaccinated, should be taking hepatitis B vaccination. This vaccination, if taken in 3 doses, if you take first dose today, 0, second dose will be after 1 month, and third dose will be after 6 weeks, 6 months. So if you can take these 3 vaccinations, you are protected from hepatitis B lifelong by 99.9%. So remember this, all of you should get vaccinated. And the most frequently used screening test for hepatitis B is HBsAg. So if HBsAg is positive, that means you have hepatitis B infection. That is the most important thing. And not all people with hepatitis B require treatment. And if at all there is a requirement of treatment, there are good medications available to treat hepatitis B. Only when the virus is active and causing some amount of damage to your liver, that is when we start at these antiviral medications, and we will be able to control the disease and avoid the complications hepatitis B can cause, like cirrhosis of liver and liver cancer. So that is very important. When we come to hepatitis C, so hepatitis C is also an infectious disease which affects primarily the liver, and it is caused by hepatitis C virus. The infection is most of the time asymptomatic, but chronic infection can lead to scarring of liver and ultimately to cirrhosis of liver. This cirrhosis by any cause, eventually 1 to 2% of them progress to hepatocellular carcinoma or liver cancer. So again, as I said, hepatitis C is spread primarily by blood-to-blood contact associated with intravenous drug abuse, poorly sterilized medical equipment, and transfusions. It is also transmitted by mother-to-child transmission, sexual transmission, all those things. And the most important screening test for hepatitis C is anti-HCV. And unfortunately, there is no vaccine available for hepatitis C. But fortunate thing is, till 2015, we were worried about hepatitis C. If someone has hepatitis C, the treatment options were not very good. Even if there were treatment options, it has a lot of side effects and complications. And after taking those injections with all these side effects and complications, the response rate or cure rates were just about 50%. Today, from 2015 onwards, we have seen dynamic change in the treatment of hepatitis C, and hepatitis C is now curable. Only chronic virus which can be curable is hepatitis C. We have good medications available for hepatitis C, and if you take one tablet a day for 12 weeks, in 99% of the cases, hepatitis C is curable. So, how do we save our liver? Most important, everyone should be vaccinated for hepatitis B, and a lot of patients has hepatitis B and hepatitis C without any symptoms. They also don't know that they have hepatitis B or C. So, only answer for that, or how to find these missing millions, is everybody should get voluntarily tested for HBsAg or HCV. once in their lifetime. So I would request all of you who are here, get yourselves checked and encourage at least 50 people around you to get this virus checked. So you don't know, average Indian, average Indian, what do you say, uh, incidence or prevalence of hepatitis B and hepatitis C is around 5%. So if you test 100 people, average around 5 people will be infected either with hepatitis B or hepatitis C. And in a few areas, uh, like few areas in East and West Godavari, few areas in Telangana, where I have tested more people, I have seen the incidence has gone up to 12 to 20% in few areas. So we are not very sure which area has highest incidence and prevalence. So I urge all of you to one each person, please encourage at least 50 people and get a voluntary test for HBsAg and hepatitis C, anti-HCV. This is the challenge now, finding the missing millions. So if we are able to identify these people, we will be able to treat them and these viruses. And once you treat these viruses, we will be able to save the liver from chronic damage, like from progressing to cirrhosis or liver cancer. And again, hepatitis C, when identified early, is completely curable disease. Remember this. Identifying early is very, very important. If you have symptoms, you are already in a state of cirrhosis. So that may not help. So most important thing which is raising now is fatty liver disease. If there is extra fat, around more than 5% of fat on the liver cells, and if it is not caused by alcohol, we call it as non-alcoholic fatty liver disease, or now we are calling it as metabolic dysfunction associated steatohepatitis, steatotic liver disease. So simple fat is a benign condition where your liver function test shows normal. Your enzymes SGOT and SGPT will be normal, but this can progress to a condition called NASH. NASH is non-alcoholic steatohepatitis, where you see inflammation in the liver. Indirectly, you see SGOT and SGPT enzymes elevated. This condition can progress to fibrosis and then to cirrhosis of liver. This is important to know. So this may take 15-20 years, but sometimes it can take 5 to 10 years only. So who is prone, who will progress to fibrosis or cirrhosis is difficult to analyze. So at this point of time, fatty liver disease is the most common cause for chronic liver disease in the United States, and it is now on rise in the rest of the world, including India. Now it is the leading indication for liver transplantation in the United States, and it is strongly associated with obesity and insulin resistance. Who gets fatty liver? 1 in 5 adults, they may have fatty liver, but this number is 1 in 2 when we are talking about when we are talking about people who are living in cities, urban population. And 4 in 5 adults who are obese have fatty liver. Obesity increases the risk of fatty liver. Type 2 diabetes increases the risk of fatty liver. And very rapid weight loss also causes fatty liver. Remember this. And as age grows, and in men, fatty liver is more. As of today, treatments for NAFLD, there is no medical treatment which is yet approved for non-alcoholic fatty liver disease. Most important treatment is eating a healthy diet and exercising regularly. This plays a very, very important role in treatment of NASH, treatment of NAFLD, or reversal. So remember, you need to eat healthy and exercise regularly. That's the only thing. Alcohol should be avoided completely. And if you are diabetic, please control diabetes. As of now, approved medication with the proven benefits are not seen. So this is how a normal liver looks. As I told you, it helps in conducting like 600 vital functions in our body. This is how a liver looks when there is a lot of fat. And this is the cirrhotic liver where there is a lot of scarring and functionality comes down. And this may eventually progress to liver cancer also. So when we are talking about symptoms, liver disease, unfortunate thing is most of the time when the liver damages completely, we start seeing the symptoms. And these are actually complications of cirrhosis, not just cirrhosis symptoms. These are all the complications. So you may see jaundice when there is worsening of liver problem. You may see ascites, fluid in the abdominal cavity, and sometimes there can be fluid in the lower limbs also, swelling in the legs. People also can present with something called hematemesis. Hematemesis is vomiting blood, or they can have black color motion, which indicates that there is bleeding inside. There can be swelling or rupture of esophageal varices, blood vessels in the food pipe, which can cause this bleeding problem. And some people see, as the liver acts as a filter normally, and in patients with liver disease there is increased production of ammonia, which will not be filtered by the liver, and this goes into the systemic circulation, which can cause confusion up to coma. This is called hepatic encephalopathy. So this is how, these are the complications what we see when patients have decompensated cirrhosis. This is a patient who has a lot of ascites. These are the varices what I was talking, the swollen blood vessels in the food pipe. They can rupture and cause GI bleed. This is how we manage them. We call it as variceal banding. So when we come to management of liver diseases, alcohol, absolute abstinence is the treatment of choice. And for patients with hepatitis B and hepatitis C, excellent medical management treatments with the medications is approved. And you need to do nutritional management, hepatoprotective agents. And when there is decompensation of liver disease or cirrhotic liver, the option is always liver transplantation. I think I will stop my talk here, sir, and I would ask if there are any questions.
You can continue, sir. Shortly, we can finish off. 4 or 5 slides are left, I think, sir.
Yeah, this is all liver transplantation. I thought we will avoid this, sir. That's it.
Okay, sir.
Yeah.
Okay, sir. Thank you very much, sir.
Yeah, thank you, sir.
Sir, from the audience, anybody has any questions? Please post questions. Sir, actually, I got one question regarding the diet, sir.
Yeah.
So, what would be the best diet? Like, so even my patients also ask us so many times. So, which is the best diet for liver disease? Suppose we have fatty liver, what fruits are better? What types of pulses we have to eat? So, so many YouTubes, so many people are seeing and
Yeah.
asking so many questions, sir. Please.
So one simple thing I would suggest, sir. So anybody who has fatty liver disease, definitely please avoid sugars, sweets, deep fried and oily foods. So fresh foods, fresh fruits, fresh vegetables, freshly cooked food is what everybody should be taking. And I would suggest all of you, please avoid packed foods. All these stored items, what we are talking as processed, ultra processed foods, are nothing but packed foods. Anything which is available in packets, they have lot of preservatives. This can cause lot of fatty liver. Anything which has excessive oily food, excessive oil, will cause lot of fatty liver. Any food which has excessive sugars, and for younger generation, I would say, yeah, all of you have been taking a lot of Coca-Colas, sugary drinks, energy drinks. They have a lot of sugar, which is actually harmful to your liver. So all these things should be avoided. Go back to your native diet. Try and have fresh fruits, fresh vegetables, and good amount of protein. If someone is taking only vegetarian, you can have a lot of paneer. All types of pulses are good. Everything has good amount of protein. You can have it. If someone is a non-vegetarian, lean meat is poultry meat. It can be egg or chicken and fish. They are all good protein supplements. Anybody, even if they have fatty liver, they can have these things. Someone who has already cirrhosis, most important thing is salt restrictions. I would suggest, I would ask them to restrict their salt intake to 4 to 6 grams per day. Salt intake should be 4 to 6 grams per day in patients who already have cirrhosis of liver. Other than that, they don't need to restrict anything. They have to eat good amount of protein and a balanced diet like anybody. They may require excess protein than normal person.
One question in the chat box, sir. Can a person who is in contact with HbsAg positive take the hepatitis B vaccine as a preventive measure?
Definitely, yeah, anybody who is in contact with the patient, with people who has hepatitis B. So, for example, I can say any family member has hepatitis B. All the other family members should get themselves checked on day one when they know it, and if they are negative, all of them should get vaccinated for hepatitis B and hepatitis B. 3 doses of vaccination, as I already mentioned, is very important, and it gives lifelong protection. And if somebody wants to know whether, yeah, I have taken vaccination, whether it is protective or not, there is a test called anti-HBs titers. Any one of you can get it done. Some people have a suspicion. Maybe I got vaccinated when I was a child. You want to know your status of vaccination, you can do the same anti-HBs titers. And if the number is more than 10, definitely you are vaccinated and you are protected. Family members, I would suggest, if your number is more than 100, you are protected. If it is less than 100 and more than 10, one booster dose will definitely increase it. And if the value is less than 10, 3 doses of vaccination should be taken.
Yes, sir. Thank you, sir. Sir, one more question, sir. What is the reason for fatty liver? 90% of people are having this problem.
So as I told you, sir, it is all the lifestyle, the type of food what we are eating, and a lot of lack of exercise. These are the two important things which is the cause for fatty liver disease. We have been seeing alarming rise of fatty liver disease, and unfortunate thing is we are seeing fatty liver even in children today. So everything starts with the type of diet. What we eat is the problem. So avoid outside excessive oily foods, processed foods, and stick to your native diet. Try and have good amount of fresh fruits, fresh vegetables, and anything which is cooked freshly. So this is the reason, the change in the dietary habits is the reason for alarming rise. So children now they start eating chips maybe when they are 5 to 6 years old. So everything is processed and ultra processed food. That is the reason for your fatty liver disease. And a lot of advertisements about all these soft drinks, and this is hampering our health. So please avoid all those things. Your fatty liver, even if you have it, it is going to reverse. And if you don't have it, you will be able to prevent from getting a fatty liver.
One more question, sir. If anyone who has hepatitis B in the past and if they go through positive anti-HBC and have anti-HBS more than 100, are they allowed to donate blood as per Indian rules now?
Now, if they have anti-HBC, we still don't take blood from them, even if the HbsAg has disappeared. So now, when we are doing NAT testing, we are doing anti-HBC also in the blood banks. So problem is anti-HBC may be protective to the person who had the infection, but if it is transmitted to some others, and if at all at any point of time that person is immunocompromised, if their immunity comes down, this anti-HBC can turn and become HbsAg positive in them. So for transfusions, we are not accepting anti-HBC positive. Core antibody is what they are saying. Even today, we don't want anti-HBC transfusions to be done.
Okay, sir. Sir, can you say the quantity of oil, sir? Because everybody who is coming to me, we reduce the oil means they are saying we are reducing. But is there any specific quantity we suggest, sir, for uh, for healthy food habits per month quantity like that, sir?
It is very difficult to quantify, sir. So one thing, a very simple thing what I can say is, so most of the time if there is a family of 3 members or 4 members, maybe 1 liter of oil is more than enough for a whole month. I'm
Yes,
talking
sir.
about a 3 to 4 member family, but I
Yes,
don't
sir.
think that is happening anywhere in the country. Everybody says we are eating low, we don't eat oil at all, but we have
Yes, sir.
been consuming a lot of oil.
Yes, sir. Yes, sir. And sir, there are so many patients who are coming to us having anxiety and panic after being diagnosed with hepatitis, sir.
Yeah.
So how do we counsel and what confidence we can give and what measures we can tell, sir? Because they are literally into panic, sir. Because we have recently seen one person who is unmarried and he found to be hepatitis positive, and he is come with sweating and he's sitting in front of me asking, sir, what I have to do? What is my future? What is my life?
So that's what, sir. See, awareness, proper knowledge and proper awareness is not there in the community about hepatitis B, and there is lot of taboo. People think hepatitis B is similar to HIV. That is very unfortunate. People, many of the people don't know anything about hepatitis B, and people who know, they think it is something like HIV. That is the reason why people are worried a lot. Hepatitis B is dangerous only when they don't know that they are carrying the virus. Once you are diagnosed, you are actually in a very, very safe hand. So once you are diagnosed to have hepatitis B, once in 6 months, so on the initial day, we do the testing and we decide whether the virus is active or inactive. If the virus is inactive, there is no need for medication. But these people should be followed up. This inactivity can become active over a period of time. So it can become active or it can remain dormant continuously throughout their life. But the 20% in whom the activity increases, we want to identify that at an early stage. So once in 6 months, we do a simple liver function test. At any point of time, if the liver function test is abnormal, we will try and do the viral load. Only these people who have abnormal liver function test and increased viral load, they will require treatment. And once we start them on treatment,
Posted people with HBsAg positive, but no viral.
and then, madam?
Please continue, sir.
So these people, we don't need to treat them, we need to follow them. Viral load less than detectable limit, we don't start them on any treatment at that point of time. More important is only when there is altered LFT. This is when we come to know that this liver function test is being altered and the virus is becoming active and causing initial problem to the liver. Those are the patients we need to treat. So for knowing this, for knowing the early damage, once in 6 months, liver function test should be done. There is nothing to panic about hepatitis B. And most important is, as I told you, if a female in a childbearing age is hepatitis B positive, during pregnancy, we can start her on antivirals. And the child, immediately after birth, if we can give hepatitis B vaccination and immunoglobulin, we are going to prevent the transmission of mother to child by 99.9%. So there is no need to worry. Only diagnosis is very, very important. Once you make a diagnosis, we have everything in place to control the disease and prevent damage of the liver disease. All these days, whatever we are seeing. So today worldwide, if I have to say a number, 85% of cases of HCC or liver cancer are because of hepatitis B or hepatitis C. And all these people, because they have been carrying these viruses without knowing that, they are they have gone into that stage. But if we can identify at an early stage without panicking, if you whenever necessary you start them on treatment, antivirals, we are able to completely get the disease into control. As I told you, hepatitis C is completely curable. You identify someone with hepatitis C, do a viral load, and give them tablets once daily for 12 weeks, you are curing the virus. So there is no need of panic. More important is identifying the missing millions. That's the more important challenge today what we are facing.
Okay, sir. Sir, one more question I got from the audience is, sir, difference between the ultrasound and fibroscan in detecting the depth of the disease. Really, does fibroscan help, sir?
Yeah. So ultrasound definitely should be done for everybody. Ultrasound gives us a gross imaging of your all solid organs in the abdomen, like your liver, the spleen, the gallbladder, the kidneys, multiple things. But when we are comparing fibroscan with ultrasound, fibroscan is specifically a scan done for the liver. So fibroscan has a lot of advantages over ultrasound in assessing the liver disease. So, for example, a lot of us look at ultrasound and they say grade 1, grade 2 fatty liver disease. And unless the liver has gone into complete cirrhosis, it is difficult to identify on ultrasound. But fibroscan can identify liver disease from the stage of fibrosis also. So definitely in identifying the stage of liver disease, fibroscan plays a very, very important role more than ultrasound exclusively for liver. But when we are talking about the whole of the abdomen, ultrasound should be done first. And only to assess specifically for liver disease, fibroscan is advised.
Sir, what are your guidelines for obesity, sir? Because obesity is also now very, very rampant, and so many people are asking about obesity, how to control, and it is linked in with all these problems. Major all metabolic diseases are linked with obesity. So, with your experience, what is your say? Because many people are thinking if you use medicine, they will reduce obesity. They are going for obesity clinics, trying to get medication.
Sir, most important and tried and tested thing for obesity would be lifestyle modification. People want easy routes and shortcuts for everything. That is why all these things are coming up. Ideally, most important thing for a weight loss, it is a simple mathematics. So the amount of calories you are taking and the amount of calories you are spending. This is how someone gains weight or loses weight. If the amount of calories you are taking in is more than the amount of calories you are spending in a day, over a period of time, you are accumulating calories. This calories is nothing but weight. So, if you can simply balance the type of diet and the calories in your diet and shed more calories by doing more exercise, it is the simplest and the most sustainable way to lose weight. So problem here is everybody eats outside. There is a lot of unsaturated, polysaturated fats in the reused oil which is being cooked. Lot of infections which are altering your gut microbiota, and this itself is increasing the inflammation inside your body. This inflammation inside your body is causing fatty liver, is causing obesity, and reason for multiple problems. So whatever you eat is causing diseases. So if you are not eating healthy, you are prone to multiple diseases. It's the simple logic. So once you are obese, it is again the exercise, what you do, and the type of food what you eat plays a very important role. You start eating sugar every day, you eat excess oil every day, you are definitely increasing the amount of calories you take. You include fresh fruits and fresh vegetables, decrease the quantity of rice, decrease the quantity of sugars, and decrease the quantity of all your sugary drinks. You are definitely cutting down on your calories and spend more calories on exercise. Do your exercise vigorously, regularly for at least 1 hour in a day. You are spending more calories. So negative balance of at least 100 and 100, 200 calories in a day, you will lose at least 1 kg in 15 days. It's a very simple mathematics, which is what people don't want to understand, and they are taking shortcuts. They want a medicine, they want a surgery, all those things. In spite of doing all these things, there are very few set of people who may not lose weight. Only in those people, the next step of treatment, either medication or surgeries, are advocated.
Okay, sir. Thank you very much, sir. And for our students, you guide them how to create awareness because you are already into a foundation, making a lot of change in the impact in the society. So your valuable words for our students, because most of them who are listening are students. So will you please guide them with your guidance and how to go into public and how to make people aware and what is the responsibility as a doctor? This is my question, sir.
Yeah. See, sir, the most important is because people don't know about these viruses, the awareness is very, very less. Once you make them aware that there are some diseases like this, and when I'm talking about someone who is staying in East and West Godavari, I would suggest there is more and more incidence and prevalence of hepatitis B and hepatitis C. So it is our responsibility to educate them and suggest them a voluntary testing. Recently, a lot of people are getting their blood tests, sugar testing, and all those things because they are aware that there is something called diabetes which can cause problems to your body. So similarly, if we make people aware about these problems like hepatitis B and hepatitis C and tell them if left untreated, this can go into cirrhosis and liver cancer, people will be ready to do their tests voluntarily. So at this point of time, we don't need to look at the cost of investigations or medications. National hepatitis, National Viral Hepatitis Control Program is in place since 2018, and anybody who needs hepatitis B or hepatitis C drugs, they are being given free of cost in government institutes. Nodal offices are established in each state, and the drugs are free. So again, the drugs are free, the drugs are effective, but still there is a lot of infection going on inside the community. That is again lack of awareness. Only most important thing what we need to do is drive the awareness in the public and encourage them to get themselves checked for hepatitis B and hepatitis C once in their lifetime, and encourage vaccinations. Hepatitis B vaccination is very safe, tried and tested. It's been there since 1982, and all of us, I mean, including me, I got vaccinated in 1996. So many of us got vaccinated, and it is the safe vaccine. Don't worry, vaccine means people think about COVID vaccine, side effects, and all those things. This is a very tried and tested vaccine. It is very safe. You have to drive awareness and ask people to get vaccinated.
Okay, sir. Thank you very much, sir. Thank you very much for your valuable information on hepatitis. And we will conclude, sir.
Thank you, sir.
Yes, sir. So as we bring this incredible, insightful webinar to a close on Hepatitis Day with the theme Hepatitis, let's break it down, resonating, I would like to extend our sincerest gratitude to everyone who participated today. Your engagement and thoughtful questions have made this session truly enriching, reinforcing our shared commitment to combating hepatitis. A very special thank to our esteemed speaker, Dr. K. Somasekhara Rao Garu, for sharing his invaluable knowledge and expertise with us. His presentation on hepatitis was truly illuminating, and his dedication to eradicating hepatitis through initiatives like the Save the Liver Foundation serves as an inspiration, especially today, as we strive to break down the challenges of hepatitis. We also express our deepest appreciation to ASR Homeopathic Medical College Management, the ALISHA Academy, the National Commission for Homeopathy, and the NTR University of Health Sciences, and all the homeopathic college principals all over India for their support and for gracing us with their presence. Your collaboration is vital in spreading awareness and promoting liver health. Your feedback is incredibly important to us as we strive to improve our future events. A feedback form will be sent to you shortly after this webinar concludes through email. We hope you found this webinar both informative and engaging, and it encourages continued action beyond World Hepatitis Day to break it down. Thank you once again for joining us, and we look forward to seeing you at our next event. Thank you very much, sir. Thank you.
Thank you, sir. Thank you.
Thank you, sir. Thank you.